Well, hey there, Dr. Andrew Gorecki, owner of Superior Physical Therapy. And what is the saying? History has a tendency to repeat itself. And for me personally, that has happened. If for those that know me and have maybe followed me for the last couple of years, a lot of times I talk about back in 2006, I had a pretty serious back injury, lasted 18 months, went through every treatment you could imagine, including surgery, and it didn't help. And it wasn't until I found, a therapist who recognized it was actually my hips not moving that was causing my back pain. Well, in 2006, I had a disc herniation in L4, L5. And the reason that nothing was helping was because my hips weren't moving and it was causing the herniation to continue to recur even after surgery. Well, here we are to 2021, and the last couple of months I've been having some pretty serious back pain, and it was hurting when I was sitting and laying down, which is odd. And the most concerning, and I'm not really sure exactly what happened. I know in February I had a sledding accident with two of my kids, and my back was kind of hurting since then. And so the thing that was concerning me was that it was hurting really bad at nighttime. And so anytime you have nighttime pain, that can be an indicator of cancer. So I went ahead and got an MRI. And if you look down and you follow the lumbar spine here, everything looks really good. And this is actually my old surgery right here, L4, L5. And you can see right there, there's a little ball. That's a extruded disc. So another herniated disc at L5S1. We can even read the report here that the radiologist sent here. So I'm able to log into the system as a provider. And so here we go. Here's my information, right? You can see down here, I usually go right to the impression at the bottom. So you can see number 2, a large extruded disc causing effacement of the left lateral recess and exiting nerve root. Not good. Here even says it right here. Left paracentral protrusion extending to the neuroforaminal foramen with an extruded fragment basically touching the lateral recess and the nerve. So yep, there's definitely something going on there, and I'm pretty bummed out. Just found out yesterday that's what's going on. I had suspected it, but now, what are we going to do now? So if you've been following me, you know that I'm not a huge fan of surgery, really not a huge fan of injections. I've been there, done that, right? So I think the silver lining here is I'm going to demonstrate to you what I do, how I do it, and how I'm going to get this to go away. So if I go back to the image here, there's actually some good news in the imaging. See if I can pull that back up and show you what I think is good news. So there's tons of studies to show that a extruded segment, a disc that actually blows out or extrudes a fragment, there's actually a lot of research to say that those are more likely to heal on their own. It's called spontaneous regression of the disc. And if I go over to this image with what's called contrast, and I zoom to that area, there it is right there. You can see it's a little different looking than last time. You can see right here, this is the little extruded fragment, the disc that's pushing on the nerve. You see that white ring around that? That's actually inflammation. That's a good thing. I mean, it hurts, but what it is, inflammation is the body's immune system. So what should happen here is the immune system should basically dissolve that disc material, and it should then go away, right? It almost like encapsulates it into a ball, eats it away, and then it regresses back to looking like these other discs. So that's actually better than, let's say, if it was just bulging a little bit. Studies show that typically doesn't happen as well. So I'm hoping that the body's going to do its job and spontaneously dissolve and regress that disc extruded fragment. And what I'm going to do is I'm going to try to reduce the motion that's happening. So this ultimately happens from too much motion in this segment. And too much motion is going to happen when the areas above and the areas below the disc fragment are moving not enough, and it forced this area to move too much. Now, so what I'm going to do is every day, I'm going to be focusing on getting the areas below, so my hips and the areas above my upper spine to move more so that we can accelerate this healing process. I can tell you the last month, things have been getting a lot better. I'm sleeping. This has been going on since about February, so about 2 to 3 months. And the first 4 to 6 weeks, I was sleeping on the ground and I couldn't do much. I was waking up in the morning and my pelvis was listed or tilted one way to try to open up the space where that nerve is. So it's been an interesting couple months. I've been here before. I've done this before, so I think I'm going to be okay. But it's going to be fun to kind of walk you through my journey in resolving this disc herniation. And maybe that's a silver lining. Maybe some people don't care, but if you are out there and you do have back pain, you might care about this. And so I'm hoping that this helps somebody. And of course, I want to try to help myself be able to enjoy the spring and the summer and play with my kids. So, yep, history repeated itself. I look forward to sharing the rest of my journey with you.